The lack of transportation options in rural areas has a significant impact on residents getting the access to health care that they need. Let's take a look at how communities are coming together to give residents both the transportation and health care access they deserve. Brandy, many communities are still facing huge gaps in terms of public transportation, especially transportation that gets people to health care. How do you get started on a local innovation?
Yeah, so most definitely what we're hearing in community is that there's a shortage of workers. So for individuals who need jobs, like for example, and so when it comes to the transportation services that currently exist, they're in need of drivers for their programs, right? And so finding a qualified workforce to be able to put in those positions. And, communities are partnering, they call it supplemental transportation. So not to undercut the existing programming, but to supplement what's already there. So those folks are also in need of drivers. So people are creating these transportation services and programs, but the workers are needed to be able to reach the most needy.
What are the other challenges a community might face, Hannah, as they try to develop one of these local supplemental transportation programs?
I think one of the challenges that Brandy brought up is really spot on, the ability to really provide those wraparound services and coordinate between those more formal services and the informal services that are allowing these innovations to occur.
So say more about that. What is that connection between the formal and the informal?
I think there are a number of ways that that can happen, and it can really be customized to the community. It can happen through some informal channels like relationships with area agencies on aging, the community's county DHHS systems, as well as the public transportation providers themselves. Really is hyper-local in how those relationships are already in existence and who's got those connections that they can leverage.
So you need a workforce, you need relationships, connections. What else would you need in a local community, Jason?
Well, I think there has to be consensus and a sense of vision on how this particular transportation issue fits within the broader context of the transportation challenges any rural community has. It's a challenge of attention, that is having local leaders who understand where transportation is going in the future and can articulate their needs to their RPOs, to develop plans and to work with DOT around funding projects. It's an issue of money. Most of the state transportation money, and for that matter federal money I would guess, but particularly the state money, we have hyper growth in our urban areas. Much of our transportation dollars, rightfully so, goes there to deal with congestion issues. So rural communities are always having to make tough decisions of, well, do we focus on our limited resources we have access to on repairing that bridge? Is it widening a road to make it safer for general transit? So this issue is embedded within a very difficult challenge and larger issue of rural transportation.
So I want to get two additional questions in that I think will be important for our viewers. The first question I'll give to you, Jason. People are going to say, I don't really understand the emphasis on public transportation. Why can't we just have people drive themselves to healthcare facilities?
Well, the challenge we have is that if we have individuals with chronic health issues, they may be wheelchair bound. They may not be able to drive. The other challenge, and I raised it early on, is that we've got an aging population. And as you age, you shouldn't be driving.
Got it.
So that's the challenge. That's the challenge there. The other challenge I might add is it's almost less of a transportation issue than it is of a community design issue. That as we have an aging population, we need to get more people living in proximity to one another in a multi-generational setting that also has health benefits. There's huge housing implications to health, but that's another show.
Indeed, and we are in fact out of time. Thank you all very much for your contributions to this segment. A lot to think about.